if you are eating late, suppose if you are eating at 11 o'clock or 12 o'clock, I'm coming home at 10 o'clock and then I'm eating at 11 o'clock, when do I have the time to do all that? So then automatically everybody comes with, oh, I'm having indigestion, oh, I'm having constipation, oh, my food is, I'm having belching, oh, I'm not able to eat, oh, I'm not able to digest. It is, see, if you do not support your body will not support you.
Hello and welcome to the Sharnu podcast with Dr. Sagorika. She has 35 years of experience in preventive health and functional medicine, where we talk about women's wellness and hormonal balance and the power of preventive care of every stage of life. Thank you so much, and let's welcome Dr. Sagorika.
Hi, doctor.
Hi. Hello.
Okay. So, what does preventive health really mean, and why is it becoming increasingly important today?
So basically, when we talk about health is when we say it's absence of disease, but it is not just absence of disease. It's actually you feeling well. Okay. So when we say preventive health, it means we try to stay ahead of the disease instead of we running after the disease and just doing the treatment. So before the treatment, before the disease occurs, we are trying to prevent it. Earlier days we used to say that one apple a day keeps a doctor away.
Yes, absolutely.
So nowadays we say that a health check a year keeps the hospital away. Okay,
Nice.
and it is very important for doing these preventive checks because it is becoming extremely important for the reason that much younger and younger people are coming up with problems, lifestyle problems. What you would say your parents had in the age of 50s, we are seeing in the age of 30s. So it becomes very important to prevent those and start it at a much earlier stage of the disease. So that's what preventive diseases or preventive health is all about.
Okay, nice. So, what are lifestyle disease, and what are the most common ones today?
See, when you say the question lifestyle disease, the name itself suggests, it is basically we are creating those diseases by choosing the wrong lifestyle.
Like,
See, we already we are born with certain genetics, okay? Now we can't do anything about that. So whatever genes we are blessed from our parents, we have to live with it. But when we say choosing wrong lifestyle, I would say, we are eating the wrong kind of food. We are eating more processed food. We are hardly moving nowadays. So we are living a very sedentary life. We are starting the habits of smoking or alcohol at a much earlier age. Even school-going children are having it.
yes.
And then, everybody in our life is nowadays stressed. Ask
Absolutely.
any person, the person is stressed. So,
Completely.
and because of that, we are losing our sleep. Not only just because of our stress, but also because of so many other issues. We want to stay with our mobiles, our laptops. So we are wasting a lot of time and we're not sleeping. So all these are lifestyle factors which actually create a disease, which we are not realizing today. But, when these factors stay with us for about 10-15 years, we do land up with a problem.
So, according to what are the top 5 foods which we must avoid?
Avoid foods you're
Foods,
talking
yeah.
about. Okay, food mainly we should avoid is, the processed food. Most important is processed food. Very high sugary items. Colas we should avoid. Okay. And obviously very fatty, deep fried foods we have to avoid. And I would say more than avoiding these, what we should be more careful about is what we are eating. Okay, so we should be very careful about what is in our plate. Okay, so it should be like, I would say 50% of your plate should be of vegetables.
Vegetables.
Yes, vegetables. And 25% of your plate should be of proteins. So proteins, as a vegetarian, you could be dals, you could be having pulses, you could have milk products. Whereas milk products are also proteins. So vegetarians, that is one of the best ways of getting proteins. Okay. And only 25% of the plate should be carbs and fats. So if we follow this pattern, I think most of our problems will be solved. So that is the mantra of eating, how you're eating. And of course, time.
Mhm.
You know, at what, see, earlier in our, when we used to say our grandparents and their fathers, they used to say that, eat with the sun. Once the sun rises, you start.
Start eating.
By the time the sun sets, people, it used to get dark. So obviously life used to end after that time. So people used to go to sleep. So, everything was running around with the sun. So if we could also follow that pattern, even today, we unfortunately don't. We eat our dinners at 10 o'clock or 11 o'clock, 12 o'clock in the night, getting up late. So those things create problems.
Okay, so eating late dinner is creating a problem.
Oh, definitely. Eating late dinner is 100% creating a problem. Because see, what happens is, we always say that after you eat, you're supposed to give a 2.5 to 3 hours of time before you lie down. And maybe, walk a little or do some kind of a light physical activity so that, the food settles down in your stomach. And the peristalsis happens, the movement of the food happens properly. So, if you are eating late, suppose if you are eating at 11 o'clock or 12 o'clock, I'm coming home at 10 o'clock and then I'm eating at 11 o'clock, when do I have the time to do all that? So then automatically everybody comes with, oh, I'm having indigestion, oh, I'm having constipation, oh, my food is, I'm having belching, oh, I'm not able to eat, oh, I'm not able to digest. It is, see, if you do not support your body will not support you.
So this pattern should support, follow all the ages of people? Or
all the ages. But of course,
kids?
When in the small kids, it will be much frequent meals and they will be obviously needing more number of meals. But this I am talking mainly about adults. Okay.
Okay.
Children,
male
of course,
and female both.
Yeah, male and female both. Adults, male and female both. Children, of course, the diet will be a little different. They will need much more proteins. They will need a lot more, calciums because they are growing. So that's a completely different thing, and that needs to be followed in a little different way. The timings also will be different. But for an adult, generally, if it's a rule of thumb, then it would be better that, you eat proper breakfast at proper time, say around 8 to 9. You eat your lunch between 1:30 to latest, and you finish your dinner by 7:30, 8 latest. So that you still have. So this is what is, and most importantly, no eating in between. Avoid junk food, because that is what normally, see, we don't even realize when we are eating in between that how much we are eating. We might eat about 4 biscuits, or 2 piece, 1 bread, or maybe 1 samosa, and then we are not even realizing the amount of calories we are consuming in that. So, but that is not filling our stomach. So after that we are still eating our dinner. So that is where we are consuming more calories. We end up consuming more calories, and unfortunately we are not moving nowadays. We are 12 hours of sitting in a place working. Either somebody is especially after COVID, there is a huge amount of work from home. Even if you are working from the office, you're still working, sitting on your desk and working for long hours. And you are either doing some meetings. And you say, whenever I talk to my patients, we don't have time. See, we have to understand everybody has got 24 hours. Nobody has got 1 second extra. Okay. So we need to find time. And we do find time for whatever we like to do.
How do you motivate them in such scenario? Like people who say like, I am completely stuck in my, working
Exactly.
hours.
So then I try, see, when I talk to them, they themselves realize that whenever they are sitting in their office, it is not that they're working all the time. They may be sitting and having a chai with their friends. They may be going and, chit-chatting with their friends in between. Or maybe watching something on the laptop, which is not work. Okay? So, that is the time when you need to get up, go out, and, go for a small walk. Or just go 1 or 2 flights of stairs in your office. If you can walk up and come down maybe 2-3 times. I mean, those kind of activity, that's what I'm saying. You have to find time. And you will find time. See, if you want to meet a friend, how much ever busy you are, won't you find time?
Yes, of course.
So, finally, the question is what you want to do. Okay? And when I talk like that, then people also understand that, it is not really so difficult to find time.
Yeah.
So, and if you find time, then you do the right kind of activities during that time.
Perfect. So when did you first become interested in preventive medicine and lifestyle modifications?
Right. So, as a student, of course, all of us, we feel like, we are we are going to become great doctors and help people and take care of their diseases. And then you realize that, people just keep falling sick, and so many times we don't have the answers to their sickness. And then we realize that, it is much better if we can stop the person having the disease. Okay. And that is when, say there's something in my family which happened. My father-in-law had a problem, and we could manage to diagnose it much earlier, and so he could live for a much longer period of time. I mean, I'm talking about cancer, with such a dangerous disease. So, but then that really told me, or rather woke me up, that that as a doctor you can help people more if you can actually prevent, because giving a treatment is comparatively easier. Actually, preventing the disease is a much harder job. Because there you need to take help from the person also, the patient also. Patient has to cooperate with you, right?
So what if patient is hiding something? So let us take an example, like a patient said only 50% and 50% rest. How do you find out then?
Yes,
from them?
There are many times when patients do hide things from us. But we have certain ways of asking questions, when you ask that question and then suddenly maybe the person might say a word and then you catch on to that and then said, okay, are you trying to? Because I tell very clearly, like, if you're hiding, sometimes people say, you should never hide anything from your doctor and a lawyer. Because, when you're hiding, it is who's missing out. I'm not missing out as a doctor. It's the patient who's missing out. Because unless I get to know the whole thing, how will I be able to help you?
Right.
So that's what. So when I see, it takes a little time to develop that confidence. Of course, I understand that, the patient should have that confidence in, especially if it is something very sensitive issue, like, then they may not open up on the first.
Like, any examples?
See, like about your habits. People don't like to, since many times when I ask, do you smoke or do you take alcohol? No, I don't take alcohol. And then they come with a report and I say the liver functions. I say, okay, the liver functions are looking a little, did you take alcohol maybe a day before or a week before? Yes, doctor, maybe once. And then you catch, like, okay, fine. So it's only social drinking. I said, okay, great. But how often are those social things, And then you realize that maybe he's taking twice or thrice a week. And then you have to explain to them, that, see, I'm not sitting on judgment there for anybody, okay? I have no business doing that. It's your choice, your life as an adult. So I just explain to them. And finally, it is their choice. As I said, lifestyle is your choice.
Yes, absolutely. What are the main factors that lead a lifestyle disease? Does genetics play a role?
See, understand one thing is that, it's like, let me give you a simple example. I think maybe people can understand that. Let's assume a gun, okay? Mm-hmm. We put a bullet in it. Mm-hmm. That is the genetics.
Okay.
We take the trigger. That is the lifestyle. So if you genetics are already there, as I said, you don't have anything, you can't do anything about it. See, if already my parents are diabetic, then for me, getting diabetes is very common. Much higher risk. If both my parents are diabetic, then I've got a 50% chance of getting diabetes myself. If both my parents are diabetic. Now, okay, that is there. But what are the other lifestyles? There are we say is modifiable and non-modifiable. Mm-hmm. Genetics is not modifiable.
Not modifiable.
I cannot modify it, right? My age. How much ever I want to look young, my age will be there. Okay, chronologically, my age will increase. So that is what. So there are non-modifiable and modifiable. Now, modifiable are what? My diet, my exercises, my lifestyle choices, my sleep, my management of my stress, all those things are in my hand. So those are modifiable. So if I take care of this, maybe instead of developing the problem at 35, 40, I will be able to stretch it to say 55, 60. So I can still, 20 years, I can still stay without any problem. if I take care of my lifestyle. So that's why lifestyles become so very important.
Yeah, completely agree. So how early can these problems begin, and are you young adults at risk?
That is the scariest part which we are seeing nowadays. We are seeing, and I'm sure you all also must be reading in the news, like,
Yes.
a 25-year-old getting a heart attack,
Mm-hmm.
a 40-year-old person running in the gym, falling down on a treadmill.
Yeah.
You
Many
know,
cases
there are
happen,
so
yes.
many cases which you hear, right? So that is really scary, because these lifestyle problems we are seeing at a much younger and younger people. Earlier, what we used to see at 50, we are seeing it at 25 to 30 years of age. And I would say there is a reason for it, which I feel is this exposure to wrong lifestyles. It happens much earlier. So what maybe, our parents used to say, okay, they would start having a smoke or a drink maybe at the age of 35. Once they start working, they start doing something, having a good lifestyle. Unfortunately, children at 14, 15 in school are starting it. Smoke and drinks and drugs, everything is starting in school
Yeah, school
nowadays.
days. Yeah, nowadays.
Okay, so now what happens? 15 to 30, you're still having those 15 years of exposure, which they used to have at 35 to 50. The 15 years of exposure is still there. Unfortunately, it is starting much early.
Much earlier.
Much
Yeah,
earlier.
yeah.
So yes, and the bigger problem is our lifespan has increased thanks to medicine. So we are increasing. Now the earlier people used to live for 55, 60 years. Nowadays, people's lifespan is 80 plus, 85 years nearly.
Yeah, before.
Okay. So if I'm having a problem at 30 and I have to live till 85, 55 years I have to live with that problem.
Yes, yes.
So that is the load which the person faces, the family faces, and the country faces, because finally healthcare is being provided.
Yeah, yeah.
You end up paying from your own pocket, or the insurance is paying for it, or the somebody is paying for it, which can be very well avoided. So yes, it is a big problem. Younger people are getting affected, and so that is a much more scarier situation.
So any advice for the younger people who can avoid?
See, very simple. Like, if you see, which I worked in corporates for a long time, and I used to always see those 21, 22-year-old guys entering their work life, and as a pre-employment they would come to me, and all are they slim, trim, very active, happy, good health, everything is fine. Within a year, 5 to 10 kgs of weight gain. Started with smoking, stress is there, sleep disturbances are happening, parties are happening in office, alcohol intake is happening. So within 2 to 3 years, they would come back to me with health problems. So what I would suggest is, avoid them. Finally, see, it may sound crude, but it is actually the fact that, your company wants your work. Okay? If you fall sick, they'll have no qualms about replacing you. You will be relieved not for the particular reason, or if you're not able to provide the work which they have been giving you, if you're not able to complete that work, company will not have a problem. Like, they may take somebody else in your place. But remember that you are born with only one single body, and it's a gift.
God's gifted. Yeah.
Okay, because we never say I am the body, right? What we say, I have got a body.
I have got a body. Yeah, yeah.
So it's a gift. If it's a gift, and if it's something which I have got, see, if I take care of my car, right? Every year I service it, I take care of my fridge, I take care of my everything, mobiles, everything, except our body. And that is the only thing which is going to take you all your life. You're going to have, you don't have spare parts for body, right? Nowadays, unfortunately, we still don't. Maybe in the near future we will, but we do have some transplants, but still, it's not good enough. So we have to live with that body.
Yeah.
So you might as well take care of it.
Absolutely. How do stress and mental health impact physical well-being? Can mindfulness, meditations, or yoga really help in preventing lifestyle diseases?
Oh, yes, absolutely. As I was telling you about that, everybody is under stress. So, what happens is when we are under stress, we release certain hormones in our body.
Release certain
Yeah, we
hormones.
release certain hormones in our body, which is called as cortisols. Okay. And these are hormones which will create insulin resistance in our body. Like, the body, see, each cell, if I want to work, each cell needs sugars. For sugars, the sugar has to enter into the cell for the cell to work from the blood. Now that insulin helps for the sugars to enter into the cell. Okay. Now if there is a resistance of this, then the sugars don't enter the cell properly. And that is what we call as insulin resistance. Okay, that happens not just with the cortisol, which I'm talking about, the stress hormones, but also with, the other lifestyles, as I said. So what happens is, that's why we are low on energy. Our cells are not having sugars to work on. Suppose if I don't eat for 2 days, I will be low on energy, right?
Yeah.
So here, even if I'm eating, if my cell is not getting that sugar, the cell is still starving. So the cell is low on energy. So then that's why we start feeling fatigued. We don't have the energy level. So that's a physical outcome of a mental stress. Okay. If there is a mental stress, we are not able to sleep properly. If we are not able to sleep properly, we become irritable. Our blood pressures go up. These are all physical outcomes, actual physical outcomes of our mental health. So what I say is, taking care of mental health becomes extremely important. And for that, yes, meditation definitely helps. Meditation is what? Is basically trying to understand your own self. Just be with yourself and that is what we are not able to do nowadays. That's why we need so much of noise around us, because we cannot sit still with ourselves. 5 minutes you stay in quiet and you're just not able to sit. What to do? Can I watch this? Can I do that? Can I talk to a person? Just staying quiet with your own self. Just for 5 minutes.
5 minutes.
Just for 5 minutes. Try
Any particular time?
Early morning maybe would be good when you wake up, because that is a time when you just sit and think and be grateful about, okay, fine. I'm alive today. That's the most important thing you have to be grateful of, that I'm alive and I'm healthy, because many people don't have that, privilege. So especially from the medical field, I can tell you that many people don't get that privilege. So you have to be grateful. So gratefulness is one very important thing for mental health. If you can be grateful about what you have, then you just sit down and, plan your day quietly, that, okay, today we have to do this or do that. Or just, how do I say thanks to so and so person, or this person has been nice to me, or so many things I have, as so I need to be thankful about that. So these are the simple small little things. Writing a gratitude journal maybe before going to bed. It's a very, very small little things. Talking to a friend. Talking to a friend. A good friend is again a very good stress buster.
Yeah.
Very good stress buster. See, you're down, you're out, and you just call your friend. And then you just start, you don't even have to tell that you're feeling sad or you're feeling upset or something. But after talking 10 minutes with your friend, you automatically, yes.
They are best medicines, I guess.
You automatically calm down. Okay. And talking to a friend, or just go for a walk. Simple walk. You try doing it, try going for a walk. You will not be able to think. Because the moment you start thinking, you will stop walking. So when you go for a walk, you automatically calm down. So that is what I always tell my people who are in the corporate, like, you're very stressed out in a meeting or something. Just leave everything just for 5 minutes. You go for a walk and come back. And then again sit there, start and do it. You will calm down. It will help you. So these are the things which you can actually do, which will help your physical health.
Yeah.
So that is why I said taking care of because as I said, talking to your friends, it actually releases the good hormones, the serotonin and all. It makes you feel happy, so it's very important to do this. See, nowadays we are living we have a lot of online friends. Lots.
Social media,
unfortunately, I have got 1,000 followers, 5,000 followers, 1 million followers. But if you really want to talk to somebody at 2 o'clock in the night and you want to cry, do you really have anybody to do so? That is what is most important. And that is what, those are the people who are actually important in your life, with whom you can actually do that without feeling that, oh, what that person is going to think about me. So that becomes very, very important. So if you have that, you're lucky, be thankful, and do it and take care of your health that way.
Yeah, true. What simple daily habits can help prevent most chronic disease, and how to balance mental rest and health with the productivity in today's fast-paced world?
Okay, as I was telling you earlier also, the habits, very simple, very, very simple. Eat the right kind of food. Okay. Eat at the right time and eat with peace. Always we are in a hurry. So when you're eating, please enjoy the food, respect the food, okay, and eat peacefully, chew the food properly so that digestion happens proper. Okay, so that becomes very important. Eat the right food, eat at the right time, and eat peacefully. Second is, do some kind of physical activity. When I'm not saying that you have to every day go to the gym and pump, I have to lift 50 kgs weight. No, you don't really have to do that. Okay. You can do simple things like just go for a half an hour walk, or you can, if you don't have half an hour, you can do 10 minutes now, 10 minutes later, 15 minutes later, so about half an hour to 40 minutes of walk at least 5 days a week you should try. Okay.
Yeah.
So that is something which, this is from the exercise, and it could be a simple walk, it could be any games you want to play, it could be swim, it could be run, it could be any dancing, whatever you're enjoying do.
Okay, can you please suggest me some any 5 outdoor activities?
Outdoor activities. Yeah. Okay. That's why I said, see, some activities which you can do anywhere in the world. Okay. One is walk. One is do yoga at home. You can do Pilates, which is again, with your own body strength, own body weight. You don't need any dumbbells or anything. Okay. Then you can do some, see, we are so much online savvy now. So there are so many things online which we are seeing, we can have aerobics online classes. We can have so many things. We can do all that sitting at home. So, and those are perfectly fine, as I said, just our bodies are meant for moving. Our bodies are not, we have bones and joints. They are meant for moving. We are not supposed to be sitting for 12 hours, 14 hours in a day. So if we are not using see, if you have a cycle and you don't use the cycle for a year, it gets rusted, right? So the next time when you're trying to ride the cycle, you cannot. You have to again clean up, go to the cycle wala and, get it done properly, taken care of. Similarly, servicing has to be done. Similarly, our bones and joints also, if we don't use, they go into rust phase, and the bone and joint pains, which we say is arthritis, which is age related also. I again and again tell people, your pain will actually come down if you start using the joint. Okay, so initially start doing it slowly, but nobody is asking you to squat, the full squat at the age of 60 or 70 or whatever. But at the age of 20, 30, you start with those things and you slowly continue with it. That way your bones and joints are in a much better shape. So you can do any of these kind of activities.
Okay, nice. So how can working professionals stay active despite busy schedules?
Right. So yes, that is one very big thing which nowadays we are facing, because there's a lot of, not only just time spent in the office, but a lot of professionals are also traveling, a lot. So again, as I said, there are very simple things which you can do. If you're working in an office, maybe from the parking space to whatever the office space is, if it's a good enough walking space, which is good. Otherwise, try taking the stairs up instead of using the lift. When we realize, when we are using the lift, it's very convenient for us, but at the same time, we are actually making our muscles and bones weaker. Okay, so I would suggest maybe start taking the stairs. In between, whenever you want to have some coffee break or, motivate all of your friends, whoever is in your group, all of you can just go out for about 5-10 minutes, have a simple walk and come. Okay, that will help you both physically as well as mentally. When you are actually traveling a lot, so then you will, first of all, yes, most importantly, you have to try to take care of your sleep part also, which is very important, taking rest. But at the same time, whichever place you go, whichever country wherever in the world, walking is something which you can always do.
Yeah, walking always comes first.
Walking always, because that is, we are right from 2 years of age, we learn to walk, right? That is the first thing which we learn. Absolutely. In an activity. So that is something I would say is this, continue. Till you are alive, continue, please.
So when any person starts walking before a day begins,
right?
So do he need to take anything like dry fruits or boiled water, hot water, something like that?
I would say
in an empty stomach.
No, you can actually walk in an empty stomach. Maybe it's a good thing to walk on an empty stomach, but you have to hydrate yourself. Maybe, take some water with a little lime in it, maybe, or have electrol water with you. So, because why I'm telling you empty stomach is because, see, when you're walking or whenever you're doing any exercises, your body needs more energy, obviously, right? Your muscles use. So, if you have eaten, the body will take the energy from the food which you have eaten.
Oh, so you should
That is the easier way for the body. Now you have eaten something, so body will take the energy from that. If you have not eaten, then the body has to work to take the energy from the fat of the body. Then the fat starts burning. Because the body will take the energy.
Normal like a glass of water or 2 glasses of water is enough.
About a glass or 2 glasses of water depends on how much you want. You're feeling thirsty. Your body will tell you. Your body will tell you. The thirst will tell you that whether you're thirsty, whether you need water. Body tells us everything. We just need to listen to it. Okay, so that is something very important. So yes, just hydrate yourself. Go for a walk. If you are already a diabetic or some other problems you have, then you need to be little careful, and then you need to talk to your doctor and figure out whether, because I'm taking a particular medicine before food, and then should I go for a walk, and I should not go into low sugars and all that. But otherwise, a normal healthy person, best is to go empty stomach.
Empty stomach is a better option, I think.
Yes, because then the body will start using the body's stored fat.
Okay, cool. So does early and regular screening help in preventing lifestyle disease?
Oh, definitely, because that is what we are trying to tell. That is what is preventive health, is to keep screening yourself every year. And fortunately, I would say a lot of people are becoming aware of it, and they are doing it nowadays. A lot of people will come to us that, ma'am, we had a health check, or we had a this.
We've seen this kind of for adults,
yes,
young age,
yes,
old age peoples.
Yes.
But in my life, I had never seen any kinders in hospital, or I had never seen.
Yes.
What is the reason? How they are blessed from the God that they are, good health?
No.
Or is it like that?
No. They have a lot of health issues, but unfortunately, the society does not. Are not very accepting to them, even today, which is very unfortunate, but it is changing. We do see transvestites coming to hospitals once in a while. Yeah, we do see that. Many times people come to us and even tell us about their stories, that, okay, I had a sex change operation. That also they come and tell us. So it is not that they are... But they are, it's like a more of a ghetto mentality. They tend to stay with their own people.
Or they have a special doctor for...
Possible. Obviously there are doctors who are working in that area where they live. So possibly they go to those doctors because they are more mentally more comfortable with them, what the people are going to say, or maybe I will be ostracized, or maybe I'll be laughed at. That kind of feeling they may be having. But see, we don't have any problems as doctors. Anybody for us is a person. For us, that person is a body. That person is a person. We have to see. I am pretty that way. I'm pretty open with all these things, and I have got people who do come to me.
So you had a patients.
Yeah, one or not many, but a
killers.
few patients, like, who have come for their other problems. They had their, finally they are also having a body they are also having a heart, they are also having a liver, they are also having a kidney, everything they are having, and those things can go wrong. So yes, they do come to us once in a while. See, if they come to us, we treat them. Now, if they don't come to us, we can't do anything much about it, unless, yes, as a society, we go to them and say that, we are coming to take care. Then there are many NGOs and people through whom doctors do help out those people.
Nice.
Yes.
Really good.
Yeah.
Why do you think preventive health education is still lacking among the general populations?
Preventive health education is not lacking, I would say, especially in the younger generation. Okay, I mean, in their people who are in their 20s or 30s, the information is not lacking. They are literate, but I would say they are not educated. Okay, there is a difference between being literate and being educated. They know many things. Whenever I tell them, something, the young people, yes, doctor, I know. Okay, great. What are you doing about it? What are you doing about it? Okay, then they don't have an answer. Okay, and many times the biggest problem is they come to us with, doctor, I've got a headache. Okay, fine. Do you think I've got a cancer in my head? I said, 2 days of headache and cancer, where? No, actually, we were going through Google, and Google said that, you can have this also, you can have that also. So that is the problem. You get information, but you don't know how much to filter out of it, what to take. So, when we have studied so much, obviously we know, how to understand even that 2 days of headache also, if somebody comes with us, we will, after checking the patient, we will know whether that patient needs an MRI scan immediately, whether I have to literally rush the patient, or I said no. But see, the same one patient coming with severe headache and at 220 and 120 blood pressure, I start having stress that something is going to go wrong with that patient. Patient is not still having anything. And another patient who's having just a headache for 2 days and having a 100-degree temperature, they're completely different. So that is what I'm saying. The information is there. There's a lot of information, but you really don't know what to take out of that. So you need to educate. And that is what I believe in educating, what you need to understand, how you need to understand the seriousness of an issue. That is what is education. Just knowing and reading on the Google is not education. That's why I said you're literate, but not educated.
Not educated.
Okay, so that is what I believe in, and that is exactly my podcast, which I do. My podcast name is The Health Talk with Dr. Sagorika. That's the name of the podcast, The Health Talk. And I believe in giving back to my society, because for the last, I've got about nearly 35 years of experience in this field. And I think now it's time for me to give back to the society a lot. I believe the way you give back is to educate them. See, that's why I always, even that 5 minutes when the patient is sitting in front of me, I always educate that person for something. And many times the patients have told me, doctor, nobody has told this to me before. So, see, that is where, so even when you're talking to the patient for 2 minutes also, you can give them some kind of information which will be helpful to them. Okay. So, because see, if I tell you, don't do this, you will question me. Maybe you will not question me directly, but in your mind that question will come. Kyun karu? Just because she said, mere ko nahi karna. Okay. So, but if I tell you that, you do this, because of this will happen and this will help you, then you will immediately go into your head कि अच्छा ठीक है, ये तो मेरे ही benefit के लिए बोल रही है, तो मैं करके देखता हूँ. So that is how then what happens is you become you do something which is good for your health. Okay, you will do the same thing, but the way I tell you will make a difference. So that is why I said education makes a lot of difference.
Yes, absolutely.
Yeah.
How can technology and wearable devices will help people to monitor and improve their health?
Oh, right. That is a good question, because nowadays we are living in the world of technology, and technology is actually good if you use it properly. Okay,
Yeah.
it's a tool finally. So how you use it is up to you.
Yeah.
So see, we have these wearable devices like those smart watches.
Smartwatches.
So many times it tells us, we have seen the patients coming to us with, doctor, my pulse rate is going so high. Like, they'll come running to us, and then we'll say, yeah, and then we will do an ECG, and then we'll realize that there is a problem in the heart, which we call as a fibrillation kind of a thing. So, it helps. Again, see, the technology has actually helped. Then we have these wearable, CGMs, which we call continuous glucose monitoring for diabetics. Then that tells us, 24 hours it keeps checking your sugars, what is happening with your sugars. So which food is increasing your sugars, which food is not increasing your sugars, what lifestyle is going to help you. So what happens? That's a very good graph it gives, and it makes our life much easier to explain to the patient. Like, see, you can see for yourself that, this is what is good for you, this is not good for you. So that helps them also to take those, So technology, and then there are obviously, we have those scans, much better levels of scans we have, whether we say PET scan or MRI, or, to diagnose, it helps us in a way, good diagnosis we are getting, very early diagnosis we are getting. So yes, technology is a great boon for medicine, I would say.
Nice. How does menopause affect women's physical health and metabolism?
See, understand one thing is menopause is a very natural, normal thing, and all women who live beyond a certain age will go through it. Okay, they will go through it. It's like a very normal, natural thing. Menstruation starts, menstruation ends. Okay, that is menopause. 1 year of no menstruation, and that is menopause. Problem is not the menopause. Problem is because of the menopause. Why does menopause happen is basically because our estrogens in our body, they drop. Our body stops producing estrogen, which is the main female hormone. So that's what I said. Many women come to me, oh my God, madam, I'm so bored of this menstrual, every month I'm going through menstruation. I said, be happy. Because till you're producing estrogen, till you're going through menstruation, your body is protected, because estrogen is a hormone which protects you, a woman. So when the estrogen drops, what happens is the protection slowly goes off, and then we are more exposed to getting heart diseases, diabetes, thyroid problems, osteoporosis, bone problems. So all these things, the risk of us women getting that increases much after menopause. So that's why when a person is in that, normally it happens in the age group of 45 to 55. So in the early 40s, we start telling the women, like, start screening for your health. See that your things are, your cholesterols are fine, your heart health is normal, your bone is strong enough, your calcium levels are good, your vitamin D levels are good. So once you start screening them, because you're expecting the changes. When you're expecting the changes, you start checking for the changes, and then we can take care of those changes if needed. We can supplement them, we can support them, we can maybe treat them early, or make certain lifestyle changes which can help them. So that way, that is how menopause affects every woman.
So anything of any food which they need to avoid?
See, of course, as I said, menopause, of course, it leads to, increases your risk of heart diseases, and it increases your risk of low thyroids and cholesterol and all that. So if those are the risks which are going up, or sugars, then obviously you need to avoid something very, the fatty foods, the deep fried foods, the baked items, bakery, when we say. So sweets, very high amount of sweets we have to avoid, because this is putting pressure on our body. So those are the things which we need to avoid, and we need to take a lot more of vegetables, some calcium rich food like milk products. Yeah, for vegetarians. For non-vegetarians, it is like eating meat and fish, and they contain a lot of calcium. So those, and then, eating more of fruits, a lot of fiber, those kind of things will help. So basically, as I said, if you eat a healthy diet, especially during the menopause period, it becomes very important. Then, the other problems like of hot flushes or sleep disturbances, and, you can eat a little bit of soya-based food because they contain natural flavonoids, which can help the effect of low estrogens. So those, you know, the person maybe needs to go and talk to the doctor and understand, first of all, get a health check done and understand where things are going wrong, and then maybe, accordingly make the changes so that the health is taken care of.
Okay, you said health checkup. So for health checkup, is it mandatory that we need to perform health check every year?
That depends. Like, see, when up to 40, you really don't need to do every year a health checkup. And that too, even if you, of course, you still need to do depending upon what your genetics are. Like, suppose if you have a very strong family history of a particular problem, like whether it's a heart disease or diabetes or cancer or whatever, if you have a very strong family history, then I would suggest maybe every 2 to 3 years, once you're 30, you should do it till 40. And then after 40, maybe yes, once in a year or at least once in 2 years you need to do. And after 50, I would definitely suggest that once in a year would be a good option to do it. Yes. So that we can catch things much earlier, and we don't see, when we catch things earlier, most of the times we may not even need to give medicines. People become a little aware that, my sugars are going up a little, borderline high. Okay, if I restrict my diet, doctor, will my sugars come down? I said, yes, if you do diet restriction, if you do exercises. So that motivates them to do it.
What are the 5 major, health checkup? Like, as you said, sugar, BP. Apart from this, is there any other, checkup?
See, that's again,
after 50, at the age of 50?
That's what. Again, that is depending on your, see, for after 50, for men, or rather, I would say after 40 or 45, I would say. For men, it is, of course, heart health. One is heart health. Diabetes, so your sugars need to be checked, your cholesterol needs to be checked. One very important thing which needs to be checked is your a PSA test, which is a prostate specific antigen test.
Okay, for men.
For men. That is very important because, again, like how women go through menopause, similarly, men have this is again a age related thing of the prostate. It's a gland in our body which increases slowly in size. So as age progresses, we call it benign prostatic hypertrophy, BPH. This gland slowly increases in size. Now the gland increasing in the size is not a problem, but sometimes it can give a problem, and sometimes it can go into a cancer. So that is what. So as I said, heart health, diabetes, thyroid, cancer check, and for women especially osteoporosis, bone health. Bone health. That is something which is extremely important to check, especially after 50.
Okay. Nice. What are the common symptoms and the emotional changes during menopause?
Symptoms during, if we can convert this into some physical and emotional symptoms. Physical symptoms mainly which happens is like, there's a slight amount of weight gain. There's a fatigue which happens in our body which we don't realize. There is a sleep disturbances. There's a lot of hot flushes. Hot flushes are basically a lady is sitting in an AC and then suddenly she'll start feeling extremely hot and she will sweat. Okay, everybody is feeling fine, everybody is feeling cold, but that person is feeling hot. So, people don't, sometimes you become a little bit of a laughing stock. People, make fun of you. So, but this is actually happening in her body. Okay. Then her cholesterols go up. Her thyroids may go up and down. Her sugars may go up and down. These are all the physical changes which a woman can go through when she's going through menopause. But then along with that, there's a lot of emotional things, because first of all, your sleep gets disturbed many a times because of the hot flushes, because that usually happens more in the nights. So you wake up from your sleep feeling very hot and tired. Then you're emotionally always drained, like, you're fatigued, like, and sometimes you may have a severe mood swings, like, you may be very happy at some point in time and then suddenly you might start feeling very sad. and you may start crying. And then people will say, oh, she is very moody. Like, people don't understand that she doesn't have control over these. She is going through this because of the hormonal changes. So that is the time when she actually needs a lot of support from her family. They need to understand that, yes, this is the problem. Maybe just sit with her. You don't even have to talk to her. You just be there, present with her. Like, it's okay. Just tell her that it is okay. It is normal to have these, you're nothing abnormal. There's nothing major wrong with you. Because that is what sometimes it really hurts the female's confidence. Like, am I the only person going through it? Is something wrong with me? Why am I behaving like this? I was not like this. Then they start forgetting things, because again, estrogen is very important for our brain. So when the estrogen levels goes down, you may sometimes start forgetting things, Mary. And then that also again brings your self-confidence down. 2 years back, I was remembering everything. Now I don't remember, small things. Everybody says, "Arey, she has become a bulakkad." Like, oh, she forgets everything. How can you not remember this much also? So, those actually reinforce her negative feeling about her own self. Like, she herself is feeling sad that, oh, I'm not able to remember. Oh, I'm not, maybe my capabilities are going down, but nothing is happening like this. So that's what I'm saying. You really need to be just supportive of that lady at that point in time, that yes, this is something which is very normal and natural during this phase. You will come out of it. Every lady comes out of it, just give a little mental support, just make her feel a little happy, go for walks with her, just let her be around with her friends, just support her in whatever way without criticizing her. That is all the lady is expecting or asking for. And I don't think that's a very difficult thing for the family to do.
Nice. Yeah, but someone should, guide the way you explained.
Yes,
so exactly. That is very mandatory.
Yes, so whenever the lady comes, I do make it a point that whenever a lady like this comes to me, I generally ask her to bring her husband or her family member, so that they can understand that this is not something which is, there's nothing wrong with the lady. There's nothing wrong going with the lady, she's perfectly fine. You just need to support her during these few years, like, she has been supporting you for years, like, so why can't you support her for 2-3 years? Like, that's all she's expecting.
Yeah, absolutely. So how can nutrition, exercise and mindfulness help managing a menopause naturally?
See, that's what, when I said that when there is a menopause, we do have physical changes and we have mental health changes, right?
Yeah.
So physical changes, again, as I said, the risk of lifestyle diseases.
Okay. And the physical changes of, during pregnancy also?
Yeah, during pregnancy is a completely different setup. Okay. So that is a completely different setup. When I'm saying about menopause, it is basically weight gain, risk of lifestyle. So again, the treatment or the prevention would remain the same, have a proper diet, take a lot of fluids, do your proper exercises, then mindfulness about, meditation or going for simple walks or simple, learn something new, because that really helps your brain to, remember things. So learn something new, because by that time the children have grown up, they don't need you. So give time to yourself, maybe go out with your friends, take up a new hobby. So that also helps a lot in your mental health management. So those, and then of course getting checked up very regularly every year to see if there are any physical health changes which are coming up. So that is something what a menopausal woman can do naturally. Okay. Now, if you're talking about pregnancy is a completely different setup. Okay. So that is the time. It's a very stressful period for the woman. It's a very high stress work, because a baby is forming inside her body. She is giving everything from her body to the baby. Okay, when the baby is being formed, and of course, from where is it coming from? Whether the baby's bones, skin, blood, all the organs, everything, it is coming from the mother. So if it is coming from the mother, then there is somewhere mother is losing out. So that is the reason we need to give the pregnant woman the rest, a nutritious diet, a high protein diet, all the supplements, mental rest. We say, because we say mental rest, otherwise, if mother is not happy, we say the baby will not come out as happy baby. But that is not the case. It is just that, when the mother is mentally calm, it just helps the baby to grow fast. We have seen that, a mother who is having high stress or very deficient in her nutrition and all, we do see growth retardation in the baby. Small babies, we can have growth retardation. Sometimes if the stress levels are very high or the nutrition is very poor, it can also lead in maternal and the infant death. So, yes.
Really?
Yes. So, we call it IUGR or intrauterine death. It both can happen if the nutrition is not taken care of, if the mother's mental health, physical health is not taken care of. It is a very stressful period for the woman. So, people again need to check properly. People again need to support. The family needs to support the mother. See, nowadays all the women are working. So, you need to be careful about, not overexerting yourself. Physically, I mean, and mentally also, not too much of a stressful situation. Try and avoid that. If it is becoming too much, then maybe take some off. In India, we do have leaves, maternity leaves, 6 months of maternity leaves. So, initial period is fine, but in the later period, the lady can take off.
So, according to you, maternity leave is mandatory?
It is mandatory when I say, see, nothing is mandatory, but she needs it. It is good for her.
Or she can work more during pregnancy?
Yes.
Which one is better?
That again depends on the health condition of the woman. If she is otherwise perfectly healthy, there is no other problems, the pregnancy is going on fine, she is going on fine, the baby is growing normally, then she can carry on till she is able to carry on. There are many people who carry on till the last month of the pregnancy, and just few days before the delivery they take off. So that is very normal. But suppose if the lady is not doing so well, she may be having so many other issues. She may be having high blood pressure during pregnancy. She may be having high sugars during pregnancy. She may be having too much of aches and pains, especially if there's a twin or multiple pregnancy. Then, of course, she needs to take leave much earlier.
Twins are like God gifted, or people can do, prepare?
Twins,
performing some exercise or anything?
No. Twins are, they are naturally, they happen naturally. But nowadays we are seeing more twins simply because a lot of people are going through IVF pregnancies.
Only through IVF?
IVF, then the chances of twin pregnancies are higher.
But not IVF. Naturally?
Not naturally. Naturally, it's God's gift. Yeah, absolutely. You don't know. Somebody, if you have a family history of twins, yes, your chances are higher. But otherwise, no. Otherwise, it's like, it's your luck. Yeah. Whether you say luck or ill luck, I don't know what. But that is basically God's gift. Nothing much. Nobody can do anything about it.
Okay. What are some effective coping strategies for maintaining emotional balance during menopause?
Effective coping strategies, I would say, is for mental balance. Again, as I said, is, one thing is spending time with friends. Second is picking up some hobbies. Third, a very important thing would be a me time. Just your own time. Otherwise, the lady's life just goes around like, oh, my husband has to go to office, my children have to go to school, I have to prepare this for them. So her whole clock goes around, or I have to rush to the office. Okay, so it's everything is like, you're bound by the clock. This time I have to do this, that time I have to do that, So in all that, you have to somehow find that half an hour every day for yourself and do nothing if you don't want to do anything. Just do nothing. Or I want to sit and listen to only music. Do it. I want to sit and read a book. Do it.
Right.
I want to do gardening. Do it. I want to do nothing. Just lie down. Perfect. So, that me time becomes extremely important for her to calm down. Meeting friends is a big thing. Doing physical exercises, those kind of things, that is actually going to help your emotional health.
Nice. So, what is the role of HRT in menopause? And are there Any myths about HRT you want to clarify?
See, HRT definitely helps to a large extent because HRT basically is what? We are giving estrogen hormones, okay? Or a combination of estrogen and progesterone, and maybe a very small amount of testosterone in that. So there are different combinations of HRT. So basically, as I said, HRT is just giving women hormones, okay? And the hormones could be a combination of estrogen, progesterone, testosterone. There are different combinations available. And basically, when I say menopause or when we talk about menopause, it is basically the hormones going down. So when we are giving the hormones, obviously it will help. So we are just trying to supplement those hormones. But at the same time, the hormones also have some amount of risks. Yeah, there are risks of giving hormones. So what we have to do is we have to assess each patient separately and only then decide whether the patient is in a position to be given hormones or not. So like suppose if a person is having a history of cancer, especially breast cancer in the family, then we wouldn't really advise. So that's why I said everything has to be, these kind of things they are not general, they are not supplements like vitamins that you can give it to anybody. These are very specific medicines, and each patient needs to be evaluated properly and only decided after that whether to be given or not. But yes, when we give HRT, then it does help many of the women, especially whether physically or emotionally, both.
Okay, nice. So, are there any natural remedies that can help with menopausal symptoms?
Natural remedies, as I said, there are nothing much as natural remedies. You just have to, take care of your mental health. As I said, go take care of your physical health in the way of doing your exercises, eating the right food, checking yourself regularly, and that's all. There is, as I said, it's a natural process, and you just have to, as long as you know what to expect, you will know how to handle it. So it's just that, being aware of it. See, if I know that somebody tells me that, that's why I hate when people say, that especially for small kids, giving an injection, it will not hurt. Of course it will hurt. If I'm giving an injection to a patient, it will obviously hurt. Why am I telling the wrong thing that it will not hurt? It's a very stupid thing to say. So, but many people say that, no, nothing, it will not hurt, it will not hurt. But I always tell the child, even the small child, even a 2-year-old child, I will tell, this is going to hurt. And maybe I'll pinch the child and say, this is the amount it is going to hurt. It is going to hurt. There is no point saying lies. Then the child becomes a little more accepting to it. That, okay, it is going to hurt only this much now. Okay, I can tolerate it. So, that's what I'm saying. So, as long as you're aware, you know what to expect, you will be able to handle it a little better. So, that's how you handle menopause.
Nice. So, how does menopause affect sexual health, and how can women maintain intimacy and confidence?
Yes. So, as I said, when there is a menopause, when the estrogen goes down, it creates a lot of vaginal dryness. So, because of the vaginal dryness, sexual activity can be painful, actually, and also her libido goes down. So, she is not interested in the sexual activity.
Which means
that, she is not interested. So, her partner needs to understand that maybe she is not interested. Maybe her level, today she may not be interested. Maybe 1 year down the line, she'll again get interested. That's not a problem. So, or, maybe the foreplay becomes more important, because it is now the onus lies on the partner. That, the partner and everything that need not, see, having intimacy doesn't necessarily mean having a sexual encounter. You can have intimacy just being with each other. That is also good enough intimacy. So that the partner has to understand. Partner has to make her feel wanted, needed. And, so that is how she is going to build, because she is actually having a problem. For her, intercourse is painful. So obviously she will not want to have it. So that, as long as the partner understands it. Sometimes when they come to us with that problem, we do give them jellies or some creams which helps to reduce the pain. So that also helps. That helps build the confidence. So because otherwise the woman starts feeling that maybe I'm not good enough. That I'm not good enough for my partner might start thinking of somebody else because I'm not able to provide the sexual intimacy to my partner. So that becomes a big problem. So that's why if that is the problem, then we always counsel both the husband and wife or the partners together, that this is how you have to handle the situation.
Nice. Why is family, friends, and community support so important during midlife? Can they help normalize conversations and reduce the taboo around menopause?
Yes, as I was telling you, meeting friends is one of the best things which you can do. So there is a lot of taboo still. There is a lot of taboo in anything related to menstrual health, like whether it's the starting of the menstruation or the ending of the menstruation or menstruation by itself. There is a lot of taboo, but nowadays slowly that taboo is going off. Like women are becoming more comfortable talking about it. Their husbands and their partners are becoming more comfortable in asking questions. So that is a very good thing which is happening in the society. Because this is, as I said, this is a very natural and normal thing, and we need to normalize the conversations around it. And whenever then, as I said, the women has the friends and the society. When you say, okay, I'm going through this, when 10 other people say that, okay, even I am going through it. So then the lady feels, okay, I'm not anything, this is not something abnormal with me, or I am not abnormal. I am like anybody else. So that gives a lot of builds a lot of confidence. So that is why, talking about it, sharing your thoughts, sharing your experiences make a lot of difference.
Nice. So what do you think is a misconception people have about preventive health?
Misconception, I would say the biggest misconception which people, or I think I wouldn't say misconception, I would say it's a scare. Like, that, oh, if I go for a test, something will come out.
Yeah.
Okay. Or
assuming that.
Yes, they're scared that, something will come out.
Something will come out.
So then what? Like, that is the biggest scare. And the second thing which I find really funny is many people come with a test report, and when everything is normal, and when I say that, oh good, everything is normal, and then they go, kuch nahi nikla, nothing came out. Like, they are so upset sometimes, that, oh, I've spent so much on my health check and nothing came out, like,
They are expecting to come out something.
And then they just said, thank you, stars, that nothing came out, like, So that is, I think that is the biggest scare with people have about preventive health, that, oh, it's like an ostrich attitude, if I don't see it, it doesn't exist. But that doesn't happen. Like, if I have sugar, diabetes, whether I don't know it or whether I don't know it, it will still affect my body. If I know it, at least I'll be able to prevent it. I'll be able to do something about it. But if I don't know it, it will damage my kidneys, it will damage my heart anyway. So there's no point sitting in that false sense of security. Oh, nothing is wrong with me. Oh, no, I'm fine, perfectly fine. So people generally are scared. People, that is the main thing about preventive things, that, oh, maybe my whole lifestyle will change. Oh, I will not be able to do this. Oh, I will not be. Oh, then I'll never be able to eat sugars in my life. Or I'll never be able to eat sweets in my life. Those kind of questions which they come out, I think it is out of scare. It's how, that because they are so scared that, my lifestyles may drastically change, and that they don't want to know about it. So that is what people, I think, are more scared about preventive health.
Finally, what is the one message you would like to leave for a lifelong health and well-being?
As I said right in the beginning, that our body is a gift to us, so we have to keep it healthy till we die. Okay, try and keep it as healthy as possible. So, and that is the biggest thing, we see everybody going through problems, or we see so many people dying, but we always feel, nothing is going to go wrong with me. I'll be perfectly fine. I'm very happy when you be perfectly fine, but take care of yourself. Okay, so simple things, very simple things you really need to do is take care of your diet, do your physical activity, manage your stress levels, see that you're sleeping at least 6 to 7 hours in a day, and just be happy. Try to be happy and be thankful that you are having a good body, that you are having good health. Just be thankful about it. And I think if you are able to do that, then you're sorted.
Thank you so much. I really, enjoy, getting so much of knowledge from you.
Thank you.
Also, my viewers will definitely enjoy. I would like to request my viewers, if you have any questions in your mind, please drop a comment. So we will definitely answer your questions. And once again, thank you so much, ma'am.
Thank you.
for coming
Thank you
in
for
our podcast.
inviting me. Thank you so much.
Welcome, ma'am.